Everybody ready for the Pledge of Allegiance?
Yes.
Pledge of
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Mr. Jack W. Boach,
Present.
Mr. Kevin Hahn,
Present.
Ms. Al Weiss.
Al
Excuse me, Weisel.
Present.
Weiss.
Looks like he's here.
And Mr. Craig Steckler is absent.
Okay. Anybody want to make a motion to approve the minutes?
So moved.
Second?
All in favor?
Aye.
Opposed? None. Do we have any communications?
There are no oral or written communications at this time.
Thank you. If we could start with, is Bob here yet?
Sure.
You
So why don't we start, Bob, with your, we can look at the schedule and the cash flow for, in this part, we're only talking about Morris Hyman. We'll cover the garage when we look at the financials for one last time. But at this point, we're just looking at the project schedule and cash flow for the Hyman Pavilion.
You all can probably see that better than I can, but I have my own copy in front of me. Basically, the blue line in the fourth quarter of 2016 is a status line of where we are in the schedule with those individual activities, which is on the left-hand side. The job is basically on schedule, give or take a day or two. We have worked, planned, selective premium time, 10-hour days is needed, or Saturdays in order to maintain our schedule. We're working around the rain. We're also going to continue that to keep on schedule, because with a good deal of many of these materials, such as the glazing, has been impacted a little bit, not dramatically. Trucks get held up crossing over the Sierras with in Reno and things like that, but we're overcoming that with the planning. The contractors being very proactive. We expect to maintain and keep, as you can see, our substantial and final completion dates look very safe and protected. We've used only maybe 5 or 6 of our weather contingency days, so we're not banking on having to use any of those, but we're maintaining the schedule without having to utilize any of those days. So as you can tell with the tour today, the job progressing wise is doing very well.
Thank you.
On the financials, you'll notice the very first page. The red lines are the actual approved billings, invoices, payouts from the owner. The blue lines was the planned monthly billings. As you can see, the red lines, in those 3 months, they're peaked quite a bit above the blue lines. The reason for that is we received a great deal of the equipment a little ahead of schedule. And so obviously they're able to bill for that, and we paid them for that. So we're ahead of schedule on having all the equipment. That red line now will start dipping down below the blue line, and it'll come back in balance in about 3 months, 4 months at the most. So that it will balance out. We're ahead right now. That shows up a little bit, not as dramatically, on the following schedule, which is a cumulative on the bar chart. The red line is less dramatic above the blue line in the same place and time. Now, is there any, I'm not trying to rush, you have any questions for either on the schedule or the cash flow and invoicing?
Go ahead.
Not on the presentation itself, thank you. It's just on the graphics,
Yes.
the narratives, the words are very difficult to see. To read, maybe my eyes are going better, but I couldn't read the first chart.
Okay, for the schedule?
Yeah,
Okay,
yeah, I just,
okay.
yeah.
The print
I
does
know what you're
appear
talking-
small, I thought maybe it's just my eyes.
No.
Yeah, right there. It's, I couldn't, I don't know why. It's the first time I unable to read it.
Okay.
I have a question. I don't know if it's of you or Ray, but you made a comment that on the dollars that have been spent is because of equipment. Has somebody looked at that to see if that really is what's putting this out of skew and it will come back into,
Yes,
okay,
yes, we have, yes,
thank you.
yeah. Yeah, another part is we've received all of the flooring materials. They've all been validated, going down to the warehouse in BT Mancini, and they're all here. And the flooring materials alone are about $2 million. All the door hardware is a little over $1 million itself. So we received that months earlier than anticipated, which is good because the majority of those flooring materials, they're all from Europe. You know, it's just, we can't, too bad it's not Buy American, but, so getting the stuff, we're very encouraged, the contractor and the subcontractors, they get the material, yes, you will be paid, yes, we know it's ahead of schedule, get it here. And so that's what
Okay.
happened.
Thank you. Any other questions? Thank you, Bob.
You're welcome.
Mr. Graves.
Well, this is one of those times when it's fun to report because the news is good. And so I'll try to highlight the good news and we'll go on from there. This quarter, the contractor's earnings, we're looking at the little dashboard report up there, and you can see the earnings were 60% and the elapsed time was 52%. So they definitely surged ahead with the earnings, partially due to some equipment, but I think it's also due to they're actually putting the work in the building out there, as you can see. That's interesting because at last time, end of August, we were at 44 and 44%. So to develop a 10-point spread between those two indicators is pretty impressive. And that's supported by the CPM schedule. In other words, the good progress is being supported by the fact that we're very close to exactly on schedule. It shows -8 days, but I suspect the margin of human error in updating a CPM schedule is at least 8 days, so I'm not worried about whether it's 8 days positive or 8 days negative. It's on schedule. The interesting thing, though, is that the CPM schedule has about 80 days of float built into or not float, but contingency built into the end of it. That is, if the contractor were to stay on schedule, they would finish about 80 days ahead of their contract date. So, you know, they're tracking against a schedule that's optimistic in terms of having some cushion out on the end of it. They've only used around 10 of the 33 days of weather days, and so there's really not been a great amount of impact on the construction due to the weather. They've had it weathered in enough they could keep moving. And I think the reason they're earning at the rate they are now is you can see in that building, when you get a building enclosed like that, there's all kind of work areas. They can bring in the 300 and something trade people on the job now, a little over 300. So they can bring people in and really get the work in the ground. As far as the budget, if you have a question, be sure to stop me. I'm going to keep kind of moving through this quickly. In terms of the budget, the construction remains within the budget. There are several smaller projects that we had mentioned before that we had planned and budgeted from the beginning that we will do as change orders to the construction contract, and they're pricing those now. We're trying to get a better handle on exactly how much those are going to cost. We think they're pretty close to budget at this point. Those Those projects, as I think we mentioned, are primarily linkages between the existing hospital and the pavilion. One linkage is down at the loading dock with a connecting walkway. Another linkage is one level up going into the lobby across that plaza. And then there's other work in that, the old Cup building that we had to do to make that look good between the two buildings. So that's mainly what those change order projects are all about. There's some additional projects that we're planning that are not yet funded, and those are in the process of finalizing the pricing so that we can get board approval to proceed with those projects. So overall, the budget is looking very good. As you'll see, I'm sure in the next, Chris's reports, we're looking good in terms of our project contingency, having used not much of it.
The change projects?
I'm sorry?
About the change projects?
Mm-hmm.
When do you expect those to actually, the proposals be approved on them? The costing out of those?
Some of the the costing on several of those is under study right now. Jacobs is working with a contractor reviewing their proposed pricing on those. As they clear OSHPD, as their architect designs it and OSHPD approves it, the contractor prices it, and then we, review their pricing, negotiate it as needed. So a lot of them are already at the point where they're ready to and are proceeding now, and others are soon to be there. They're things that are trying to clear OSHPD at this time.
But none of those projects are on the critical path for the other things. I mean, it's not holding anything up. Is what
Well,
my question.
some might be on the critical path, but to the extent that they're being outside of the building, they're really not on the main critical path of getting the pavilion building itself done. And we certainly want to get them done before the project is ready to open, but they're somewhat off to the side, being between the existing hospital and the pavilion.
Yeah, so to clarify that, we want them done with the building. And so in that way, they're on a critical path, but they're not impacting anything going on within the building.
Yeah. I would say they're a critical path, but not the critical path.
Right.
Okay.
And those that Ray is referring to, those connection projects, are the $3.5 million that are showing in the change order. And those were also, when we did the budgets and everything, those were all anticipated. There's allowances and things like that in the budget for this. The extra ones, or the ones that are outside of the budget, are something that we'll have to get pricing on. We'll have to go back to the board. We'll have to get approval, and they include things like, you mentioned that building for the emergency department that's out front. That was a temporary arrangement that at the end of this job will have to be removed. And so that's not in this budget, but that's one thing that will have to happen. There's a section of the back parking lot that used to have the helipad, and that, when we're done, that also was not included in this project. We're going to want to put additional parking lot out there. So we'll have to develop all those dollars, go to the board, and those can happen after the thing is open. And in some cases, like the ED building, they have to happen after it's open, because we don't abandon it until we move into the new ED. So that's kind of how we're breaking them up. So far, basically the one change order that we have here is what we anticipated. We haven't been hit with anything that's falling outside of what our expectations were for this project. But it is, I'd say that it's also, as we track all the allowances and contingencies and approve those things, it'll be tight, and I think that'll be, we're not going to have the cushion at the end of this job that we may have had at one or two of the other projects. I think it's going to go right to our budgets.
Yeah, we certainly don't see a lot of extra money being available. I mean, we're continuing to value engineer things and try to make sure that we're getting the best pricing on the work. But we are optimistic in terms of being able to finish the project within our budget. Just a couple of other issues. The safety performance continues to be excellent. There's been no lost time accidents on the job. And everything is proceeding, as I've said, pretty much on schedule, within budget, and good quality work being done out there. So it's been having a very good working relationship with team members to get things, get solve problems as we encounter them. So if anybody has any questions, be glad to take those individually, but that's pretty much the overview of where we are.
I'm glad we haven't seen the change orders because of conflicts with the architectural and engineering drawings like we did on the first one.
We've had, I think we've had really excellent service from Radcliffe. They've come into what's a tough thing. Anytime you take over another architect's job, it's tougher than taking over one of your own. And, we've had a number of things that changed along the way that really we had to take care of, and they've, stepped up and done a good job of it.
Okay. Any other questions? Thank you.
I was going to add, because Kevin asked me as we walked the building about the safety performance, and we have no lost time injuries for 734 days of the project so far. Yeah. Yeah.
Chris?
First, we're going to wrap up the parking garage. We believe all the invoices are in on this job, and we've done our reconciliations, and this is how the numbers wound up. So in total, our project budget before our contingency number totaled $22,172,872. And after tallying all the final expenditures, we spent $22,595,390. So we went over our expectations on that by about 1.9%, or almost $423,000. And ended up the job, so that came out of our contingency, of course. We ended up the job coming in under our total budget, including contingency, by almost $568,000. So from a financial standpoint, I'm pretty happy with how the numbers came out, and I think from a construction standpoint, that garage really came out nice. And I do know the employees really appreciate it and like it. We hear comments about it, and it's just been a great situation for us. So are there any questions on the parking garage? Yeah.
Yes, the variance.
Yeah, okay, so
That,
really two main drivers on the variance.
no, let me finish.
Okay,
the
go ahead.
question. The surplus, the differences between what you have it available and that you're used, you have a surplus of $568,000.
Yeah.
Does that go back into the hospital's general fund? Does it get rollover into the other project, into the emergency room?
Well,
Or-
to the extent that we didn't spend general obligation bond funds to fund the project, yes, that money now goes into the Morris Hyman Critical Care Pavilion
Okay.
job.
And then the follow-up question is,
Yeah.
if we have another variance with surplus in that, is what happens to that
If we have a surplus at the end
at
of
the end of, yeah.
Well, I'm not predicting that we're going to have a surplus. In fact, when we get to the final slide here, you'll see how the numbers add up. But getting to the variances on the parking garage, there were really two main issues that drove those overruns on the line items. One of them was, as you recall, we did run into a big problem with tying into the sewer.
Right.
We had to completely redesign that and redirect it, and that drove a lot of the variances you see up there. Under the equipment and leases line, that variance was driven by our parking lease. We were renting parking across the street at the property that was formerly owned by the Colton Company. We rented that space and then ended up starting the job, if you recall, later than we expected. And then the job ran longer than we expected, so that compounded the length of that lease and the hit from that. But other than that, those were the two main drivers here.
So, with the parking garage complete, the helipad, it's in use, is it?
Yes, yeah, it's had, I don't know how many landings at this point.
Yeah, we've had 3 in the last, this week.
Wow.
Yeah, so it is, I would say it ebbs and flows, so we're not averaging one a day, but it can get very busy there.
And I think we've gotten great comments from the pilots coming in. They like the pad, and everything's working out great there.
Was there an expectation as to what the operational frequency of use was?
No, there's the two main reasons for using the helipad is to transfer infants out if they need a level 3 nursery that could be is usually UCSF. Could go to Stanford. That would be the main reason going out, and the main reason coming in are actually there's two. Those babies do come back and go into our level 2 nursery, and then we have a neuro program where we get flights in from all over, but mostly the north of San Francisco. We get a number of neuro stroke and neuro cases that come in and are flown down here for that. So those sorts of things, they're not planned, and they just happen as things happen.
Any more questions on the garage? Okay. Let's take a look at the Morris Hyman Critical Care Pavilion. We started after the last period with expenditures of a little bit under $158 million. During the period ended November 30th, we had expenditures of $40,204,000, and again, the lion's share of that coming from the construction line item there, leaving us with total expenditures to date as of November 30th at just a fraction under $198,200,000, leaving a budget of $148,330,000, and we have expenditures reimbursed in that number so far from GO bond proceeds of $192,487,000. Denise, can we go to the next slide? This is our project cost to complete, and again, this is as of November 30th. We start with our total expenditures of $198,200,000. Right now, the estimate to complete the job is just under $142,300,000, leaving contingency of a little bit over $6 million to cover some of those projects that Ray and Ed were talking about. But as Ed said, we'll likely utilize a lot of that. So once we have some reliable numbers, we'll build them into this. So are there any questions on the projection?
Now, that 3.5 million is going to come out of that 6.6 million.
Yeah,
So-
I believe it's included in these numbers.
Included in the
Yeah.
project cost, not in the construction cost.
Yeah,
Okay,
yeah.
so that will not deduct from the contingency.
It's in the total construction budget, but it is not in the contractor's GMP. That is, we've always planned for it to be in the construction, but we didn't put it in the GMP.
So it would not go out of this contingency.
Right.
Okay, let's take a look at the sources and uses of funds. So when we started these jobs, we had in general obligation bond proceeds and interest total of about $312 million available. Of that, to date, between the parking garage and the Morris Hyman Critical Care Pavilion, we have spent $214,485,000, leaving about $97,516,000 of bond funds available. We also have some additional sources of funding of about a little over $9.3 million. Our estimated cost to complete, as you saw before, was $142,296,000. We pull back the amounts from that are not reimbursable with GO bonds, and we end up with remaining expenditures to complete the building of about $111,567,000, and that would require an additional $4.7 million out of the hospital's treasury to complete the job. So no problem doing that. And so to answer your question, Al, I don't believe there will be any general obligation bond fund surplus at the end of the job.
So Chris, you characterize it as there's no problem drawing it out of the Washington Hospital
Yes.
reserves. Can you quantify how large Washington Hospital reserves are?
Yeah, well, almost a couple $100 million, so there won't be any issue there. We are also considering a revenue bond funding to cover the equipment and that gap. We're looking into that right now. There'll be more to come from that, but I don't see any issues at this point with funding this project. We are in very good shape to do that.
So if I remember, the GO bond is for the construction of the facility, but the actual cost of the equipment or the medical equipment inside is Washington Hospital's responsibility? Is that?
Yeah, you can't, yeah, well, yes. So under the rules for general obligation bond funds, they're really only to be utilized for construction and fixed equipment, right? So bricks and mortar. Any kind of major movable equipment or medical equipment, that sort of thing, cannot be funded with the general obligation bonds. They can be funded with revenue, tax exempt revenue bonds, which would be the obligation of the hospital to pay.
So you should go to the top hat more often, make a contribution.
Yeah.
We like that idea, Al.
Thanks.
Sure.
Okay. And no more questions of Chris. So, Mr. Fain.
So, at your place, you did not get this ahead of time, is our first draft of an annual report. So, we are required to go to the board and give an annual report. We haven't done it for a number of years. Our last one was after we finished the central plant and CJR, and then we had this lull before we started going again. So the staff has made their first shot at this. In reviewing it, there's a few things we refer in there to look at pictures and things like that aren't attached. So my apologies for that, but I wanted to get it in front of you for you to take a look at. And we don't have a time set yet for any kind of presentation, but thought that if you could take some time to take a look at it, perhaps we could discuss this either before the next meeting or at the next meeting for final approval and take it forward. Yes, sir. So and it basically is trying to just define what the project is, how it's been going, what the use of the funds have been, and generally I think the last two or three, Mr. Walsh has made a presentation to the board of the final report. So we try to do this every year so that the community gets a summary of what's going on, how's it going. Okay.
So if we have changes or edits, then?
What I thought might be best is if I sent you, say, an email of this, so if you had changes or edits, if you wanted to make it on there, or if you wanted to just write back to me and say, this is the concerns, that would be great.
Do you want us to make comments off of this, or are you going to send us another draft?
I can send you it via email if that's better. If you
No,
want
but you said some of it wasn't complete. Were you going to fill in those holes first, or no?
The only thing that's not complete is pictures for
Okay.
this. So when you read it, you're going to read.
for you.
Yeah, you're going to read as seen in the picture below, and there's no
Okay.
picture. That's the only thing that's not
I
complete.
would rather have it by email.
Okay.
If you don't mind, please.
Yes, we will do that.
I think email's preferable to me.
Okay. That would be great. So we'll get that out to you, and then we'll...
Give us a deadline
Okay,
for, that way we
to get back? Okay,
don't forget about it.
okay. We'll do that. We'll give you a time frame in the email, and then I'll check in with you.
I think Mr. Balch does a wonderful job of presenting it to the board. So
He
keep
does.
that tradition going.
I got a good case of hating you going. Okay, we have our next meeting, April, I gotta put my glasses on, 19th. If nothing else, we can go ahead and adjourn our meeting. Thank you, everybody.
Thank you.
Thank you.